I am so passionate about helping to correct false claims about pediatric health that I got a grant to track what our pediatric clinicians hear in practice. They self report instances of misinformation, and I'm on a communications team that makes content to help give accurate information to families so they can make informed decisions for their children.
Now, that is really interesting, Joanna. What are you finding out about vaccinations?
Well, almost half the entries we get, 44%, are vaccine related, and the top three areas of vaccine misinformation surround following the vaccine schedule, the hepatitis B vaccine at birth, and that vaccines contain harmful ingredients.
I'm not surprised by those findings because almost every single day I work as a pediatric hospitalist, I hear one of those concerns. And I'm always thinking about how I can connect with families to talk about how important vaccines are for guaranteeing their children a healthy future and protecting their families and communities. But it's hard to know how it's going over.
You are not alone, David. Only 27% of our clinicians felt like the approaches they used to address misinformation in clinical care were actually working. So, we're all needing training and tips on how to address the vaccine misinformation we encounter in practice. Can we get Dr. Sean O'Leary back on the show?
Oh, yeah. Dr. O'Leary is our go to podcast person for how we communicate about vaccines. And he's also a professor of pediatrics and infectious diseases at the University of Colorado, Denver, and Schuetz Medical Campus and Children's Hospital, Colorado. He also used to serve as the AAP liaison for the Advisory Committee on Immunization Practices, or ACIP. Sean, welcome to the show.
Happy to be here.
Sean, before we start talking about vaccine messaging, can you tell us how your work with ACIP has changed? I think a lot of pediatricians now have lost confidence in childhood vaccination recommendations from that group.
Oof, yeah, and they should. I will just start out with the short answer, which is nothing coming out of this ACIP can really be trusted at this point. What we're seeing is just a fountain of falsehoods, and we've got a meeting, early December, scheduled early December, that is just going to be more of the same, I fear. So, um, technically, I think I am still listed as the liaison to ACIP for the American Academy of Pediatrics. That said, I think many of your listeners are probably aware that AAP has made the decision that this is not a legitimate committee at this point. The way it's been, the committee members were fired, replaced with people who really, for the most part, have little, if any, business making healthcare decisions for the American people. And so we are treating it as an illegitimate body, and the position is we are not going to lend our expertise to this circus. And so we are, however, following the events of ACIP very closely because what they do does have an impact. And we're seeing that in real time. And we can talk more about that today. But we fact check, we work with media, we work with social media, we host press conferences the days of the meetings to really try and do damage control, essentially, because that's what they're doing. They are harming the American public at this point.
You know, as pediatricians, we have been dealing with vaccine misinformation for a long time, but what is it about this moment that makes it feel so much worse?
Well, it's because it is so much worse. I think what I will say is that we have been hearing these falsehoods for decades. You name it, whatever myth, whatever piece of false information you want to talk about that we're hearing both from this ACIP as well as the administration. These are not new things. We've been dealing with this, and I would say quite successfully for many years. Going into the pandemic, we had greater than 95% coverage for routine childhood vaccines for school entry. That's taken a bit of a hit now, but most parents are still vaccinating their kids. It's down to 93% or so for 2 doses of MMR. But for the most part, we have dealt with this successfully. The problem is now it is coming from the highest levels of government, and of course that's going to confuse parents. Right? The average parent, they're not following these deliberations very closely. These lies, these myths are very easily debunked with the facts. But the problem is most parents, there's a lot going on. There's too much there's just too much, right? And so they're not following the details of these events. They're just hearing there's controversy around vaccines. And so now they're coming into pediatricians' offices, family physicians' offices, and saying, oh, I want to wait because I know there's all this controversy right now. And this controversy is completely, manufactured by the current administration.
Well, this is where I think we could really use your help, Sean. Do you mind if we walk through communication strategies for the three common vaccine myths we hear in practice? And let's start with following the routine vaccine schedule. How do we reassure families their babies can handle it?
Sure. Now, I don't want to come out and say like I know how to do this and you don't. The general pediatricians in your audience who do this all day every day, I think they have their own techniques for how to handle these things. And for a lot of them, if they're working, go with it. I'll give you a little bit of the evidence around how we handle some of these things. But there's no perfect, easy, right answer. A lot of it depends on the relationship you have with the family. If it's somebody you've taken care of their prior three kids and you've known them for years and you know them very well, and you can just say, you know what, this is a bunch of hooey versus somebody you're meeting for the first time, those are different conversations. So keep that in mind with the answers that I'll give. So, I would say we do not want to overestimate this particular moment in terms of that all parents are hesitant, because if we go into a visit with a family and we assume they're hesitant, we're going to give a weaker recommendation. We're going to come off sounding like we don't believe that much in these vaccines, which obviously that's not the case, right? We want to make it clear that we strongly recommend these vaccines. There is some evidence around the presumptive recommendation working both for parents who don't have any questions, but even for parents who have mild to moderate hesitancy about vaccines. Simply going in and saying, Johnny's due for 3 shots today, I'll have our nurse come in and give those shots. That can go a long way to overcoming some of the mild and moderate hesitancy. And then, of course, if parents have significant questions, they will ask those questions at that time. And that is a perfectly ethical way to approach these conversations, because vaccinations, we know, are the standard of care. The benefits far outweigh the risks. Now, when you do get those questions, and you obviously every pediatrician is getting those types of questions, for the schedules question specifically, I think what I would say is, I'm a big proponent of motivational interviewing techniques. I think we're still trying to build the evidence base for exactly how to do that in these conversations. You want to make sure that you understand where the parents are coming from, recognize when you start to have these conversations, don't let your blood pressure get up. Recognize that just like you as a pediatrician, these parents are just trying to do what's best for their child. And so when you go into these conversations with that mindset, not in an argumentative sense, but with the idea like they've heard a lot of things, they're just trying to make the right decision for their kid, I think it makes these conversations a little bit easier and less prone to getting into an argument, because that's what you want to avoid. So for the schedule question specifically, you might lead with say, tell me more, tell me what you've heard about the schedule. And then you can kind of dissect a little bit, what is it exactly that is concerning them? And then you can, depending on how they answer, you can then go down various paths. For example, if they say something like, well, I've just been hearing it hasn't been studied for safety. Then instead of just like saying, oh, yes, it has, which is kind of the tendency, like you want to say it because that's what you know to be true, you can say, oh, I've had that concern raised before and I looked into it. Can I just tell you a little bit about what I found out about, has it been tested for safety? And that's called Elicit, Provide, Elicit is a motivational interviewing technique. When we teach trainings, we call it actually asking permission to share. And it's just this little psychological trigger that may make parents more receptive to what you're going to share rather than just immediately, dumping it on them, dumping all the knowledge that you have on them. And that also helps you focus the conversation a little bit as well, as opposed to going with this, what we might call a data dump, where you just sort of tell them everything you know about the schedule. Try and figure out exactly what it is that they're concerned with, try and address that question directly. What we do know is that when vaccines are tested, they are tested both individually for safety as well as for effectiveness. And then they're also tested as part of the routine childhood schedule. So meaning, when you give these vaccines together, are they still safe? number one, and number two, do they still work like we want them to work? And so we don't get any vaccines into our schedule until we know the answers to those things. And also knowing that safety is always the very first, issue that we want to address. Are these safe? And so that's really something I try to emphasize is that, in the whole system of vaccination, the vaccines we recommend, the first consideration is always safety.
Sean, you and I overlapped in medical school a little
Oh,
bit,
right.
which means we have both seen the near elimination or certainly dramatic reduction of some vaccine preventable diseases in the course of our own careers. Every morning now, I'm finding myself talking to parents about hepatitis B vaccine for newborns, and they don't even understand that liver cancer used to be a thing for children who got hepatitis B. Should we be talking more about these diseases and what's changed?
Yeah, that's a challenging question because, on the one hand, as you point out, you and I have seen many of these diseases, but we haven't seen a lot of, like, we haven't, I doubt you've seen diphtheria. I haven't seen diphtheria, because vaccines work, right? There's an old saying, vaccines have become victims of their own success. So, how we handle that, so that, i.e., a lot of our trainees have not seen these diseases. A lot of young pediatricians have not seen most of these diseases. So it becomes difficult, one, for them to talk about personal experience with it, and two, there's this concept of being careful about how you use scare tactics with families. Very often, scare tactics can actually backfire. There's some literature on how you do this, but I think what I would say is a lot of it comes down to your own personal communication style and how you share these stories. So I know some pediatricians who like to share stories about influenza and the child they took care of in the ICU who had a terrible outcome, and they will tell that story with families, and they'll do it very effectively. But in other cases, sometimes people tell a story about a vaccine preventable disease and it just puts people off in terms of, kind of, well, I don't know, that sounds really scary, but I just, I'm more worried about the vaccine than I am about the story you just told. So it is very challenging. I think in general, we could use more education around some of these diseases, starting, K through 12, college, you name it. We need more education on these diseases in medical school, in residency programs, because right now, there's a pretty packed curriculum across medical school training as well as residency curriculum. And a lot of training programs give very inadequate training on vaccines and vaccine preventable diseases.
Yeah, when I was in training, one thing I never heard about were the ingredients in vaccines and how to counsel families on what's in them. The top three vaccines I hear concerns about from families are aluminum, mercury, and formaldehyde. What's the best way to talk about vaccine ingredients? Do you have a different approach for each one?
Sure. That's a challenging one. I think there are a lot of techniques I've heard. I don't know that we have a strong evidence base for one over the other. There's plenty of great factual information out there about all of these topics around ingredients. AAP has lots of good resources on that for one. Children's Hospital of Philadelphia, their Vaccine Education Center has very detailed information about all of these. And for some families, that's all you really need. Like, okay, I know you've heard some concerns about that. Here are the actual facts. And so you could use that as sort of an aid in your conversations. Like, let's talk through this issue of aluminum. Why do we use aluminum in vaccines? Is it safe? How do we know it's safe? The facts are pretty straightforward, right? Aluminum adjuvants have been used for over 80 years. They've been shown to be very safe. The reason we use them is the vaccines wouldn't work very well. The ones we use them in is the vaccines we use wouldn't work very well. Um, Aluminum, I think it's the most common metal in the Earth's crust. We encounter aluminum all day, every day. It's in the water we drink, the air we breathe, the food we eat. There are orders of magnitude more aluminum in a liter of soy formula than there are in the entire vaccine series. Aluminum, whether it's injected or ingested, is digested by the body in the same way, and eliminated relatively quickly. So there's really no factual basis for being concerned about aluminum, but it sounds scary, and so it can be very scary for parents. How you convey that information, again, can be challenging. I suggest an MI framework. but like arming yourself with the facts and then using an MI framework to share those facts with the families. Mercury, that's essentially a non-issue that was just brought up again to scare parents. Everyone knows mercury isn't good for you. Let's talk about mercury and vaccines. That was the whole strategy there of what ACIP did at the June meeting with thimerosal in the multi-dose influenza vaccines. The fact is that the amount of mercury, the specific chemical is ethyl mercury, contained in even multi-dose vials of influenza vaccines is minuscule. It doesn't accumulate in the body. It's eliminated very quickly. It's not the mercury, methyl mercury that we worry about in like tuna fish, et cetera, that does accumulate in the body. And it's out of all childhood vaccines anyway in the US. I will say it is contained in many vaccines around the world and continues to be used very safely. There have been many studies showing that the amount of thimerosal or ethyl mercury in childhood vaccines is perfectly safe. The facts are that it's a non-issue meant to scare parents. And that's true, I think, around most of these discussions around the ingredients in vaccines. Formaldehyde, same thing. And I don't know if this works for some families. It might. It depends sort of on their health literacy level. But Paul Offit has talked about the concept of the dose is the poison, right? We're exposed to like water. I've got a glass of water right here. Water is poisonous, right? If I drink 10 gallons of water, if I go out and drink that right now, I'm probably going to die. But if I drink this glass now, that's probably good for me, right? And so that's one of the concepts around a lot of these ingredient issues is that they're there in the ingredients that are in there actually to make the vaccine safer and make sure that they work. And they're in such low quantities, they're not going to cause us any harm.
Sean, I know that I'm like a lot of pediatricians in that when I'm looking for messaging guidance, I turn to the Frameworks Institute. Is that a place that you're sending a lot of pediatricians, or are there other resources or strategies that you also recommend?
Sure. So Frameworks does a lot of great work. They've done a lot of great work over the decades on various topics, and they've recently been looking at the issue of vaccines. But to be clear, what they have put together is really more public messaging. It's not really what they have put together is not really designed to be messaging in the individual clinical encounter. That wasn't the question they were asking when they gathered the data and then created their recommendations. They were trying to determine what is a good framework for public messaging around vaccines. So I think, if you're somebody who does interviews or is doing, public speaking around vaccines, yes, follow their guidance, take a look at it. There are other great sources of that kind of thing. WHO has something on how to respond to vocal vaccine deniers in public that they put together roughly 10 years ago that I think is still really useful. There are other references that I like to turn to, the Debunking Handbook, in terms of how you handle debunking myths. You lead with a fact, warn that you're going to mention the myth, explain why it's a myth, and then finish with the fact. So there are various frameworks for how you handle these things. And I think the Frameworks Institute is one good place to look. I mentioned CHOP already. I mentioned AAP already. There are lots of resources out there for looking into this. Some of this also is a matter of getting into your own sort of personal communication style. Like, how are you going to incorporate this in how you talk to people? Because we all have our own different, sort of styles when we interact with patients that we develop over the years. And so some of these you have to think about, okay, how am I going to do that? And for some people, these things are very easy. I mentioned like asking permission to share. Some people already do that, and it's really easy to add it in when you already do it. In other parts of your communication, just add it into the vaccine conversation. But if it's not something you routinely do, it can be pretty clunky the first several times you try it. So it's sometimes it's trial and error, see what works for you in the office setting.
Well, this has certainly been so helpful, Sean, and I'm bringing a lot of the tips you mentioned back to my hospital. Do you have any last takeaways for pediatricians on the front lines talking about vaccination?
Sure. There's the clinical report we published last year, Strategies for Improving Vaccine Communication and Uptake. It's in Pediatrics. I think it was the February 2024 issue. I think it's a reasonably good starting place in terms of if folks want to read, a bit more about the various communication techniques. Perhaps more importantly, in there's a long list of resources. There's all kinds of resources out there for how to do this stuff. And importantly, resources for where the facts are, where you can get the facts, because there's plenty of content out there about the actual facts. But unfortunately, that stuff is not what gets, promoted on social media. I mean, I think it might have been you all that taught me the concept that, if it scares, it shares. And so that's what we're dealing with.
Well, Dr. Sean O'Leary, thank you so much for talking with us again today.
Always a pleasure.
For helpful tips on communicating about vaccines, go to our website at aap.org/podcast.